Hi, my name is Kayla Spicer, and today I'll be performing the NG tube placement checkoff. So to begin, I'll show you my badge and scan the room. Okay. So to begin, I'm going to verify the patient care order form and the hospital policy. I'm also going to go ahead and check my patient for 2 identifiers. Mr. Jaguar Jones, date of birth August 25th, 1963. And he's allergic to penicillin according to his armband and the order form. I'm going to perform hand hygiene. Going to explain the procedure to my patient, raise the bed to a working height, and lower the side rails. I'm going to gather all of my supplies. So we've got my stethoscope, my clean gloves, water-soluble lubricant, tape, alcohol swab, pen light, scissors, goggles, the Salem tubing, and towels, and my pulse oximeter. So I'm going to perform hand hygiene again, and I'm going to place my patient in high Fowler's position. Oh, sorry. Actually, before I place my patient in high Fowler's, I'm going to assess vital signs, bowel sounds, and pulse oximetry. So I'm going to place the pulse oximeter on the patient's finger here. I'm going to auscultate for bowel sounds. Now I'll raise my patient to high Fowler's position. Going to don my clean gloves. And my goggles. And I'm going to set up my equipment. So we'll go ahead and open the packaging. And I would go ahead and apply the water-soluble lubricant onto the packaging here. Now I'm going to assess my patient for patency in the nares just by closing one and having my patient breathe normally, and then the other side and seeing which one has better patency. Going to clean the nose area with my alcohol swab. And I'm going to prepare my pieces of tape. So the first one is for my temporary securement, which I'm going to dog ear. This one is to mark the placement of the tube once I measure it out. Then I'm going to get the piece that will secure it on the patient's nose. Like that. Okay. And then one last one, which I would label to put on the patient's nose once the entire procedure is finished. Okay. So now I'm going to measure out the tubing, which I will do this on a live patient in another video. I'm going to go from the nose to the ear and down to the xiphoid process. And I'm going to mark that. Okay. Now I'm going to lubricate the end of the tubing 4 inches. And I'm going to instruct my patient to take some deep, slow breaths while I insert the tubing. And if I notice any kind of decrease in vital signs, I would stop the procedure. And I'm also going to establish a cueing sign with my patient if the procedure needs to be stopped. Okay, so I'm going to insert in here until I reach the nasopharynx. Then I'm going to encourage my patient to relax the head and flex forward, whereas when I was inserting into the nasopharynx, the patient would have their head relaxed and on the pillow. Now it's flexed forward, and I will rotate as I move it down. I'm also going to allow my patient to sip water through the straw if they need that. And rotating 1 to 2 inches. Not forcing it through. And if my patient was to start coughing or having the decreased oxygen saturation or vital signs, anything like that, I would pull back into the nasopharynx and allow the signs to stabilize again. Okay, now that I've reached the marking, I'm going to get my piece of tape and just temporarily secure that over here. Now I will get my pen light and I'm going to look in the patient's mouth, and I'd also use a tongue blade, but I don't have one. So I just visualize, make sure nothing's caught in there, and then I would take my 16 milliliter syringe and I will begin to aspirate for stomach contents to make sure that it is placed correctly.